Good afternoon, everyone, and thank you for joining us today for this exciting discussion. In the case of the pandemic in South Africa, as far as gender and its impact is concerned, time and time again, it's been illustrated by thought-provoking images across our TV screens that have touched many South Africans. One such imagery that always comes across in my mind is of a Black Soweto-based informal trader and mother who was arrested for selling acha, which some people may know as pickle, or type of pickle, at the beginning of the first hard lockdown in 2020. According to a McKinsey Global Institute study, women's livelihoods are 1.8 times more vulnerable to the pandemic than men's. And while women only make up 39% of global employment, they account for 54% overall job losses. The pandemic has undeniably exacerbated the inequalities between men and women, especially with women historically and currently responsible for unpaid work. That includes child and elderly care, and as a consequence of the pandemic, now frequently also includes care of the sick. Women's employment is dropping faster than average, and without action to counter this gender regressive scenario, the global economy will continue to be negatively affected. Informal traders and mothers like Thandi Tabete operate in a context of rising unemployment that disproportionately affects women. And according to the Labour Force survey of the second quarter of 2021, the South African labour market remains more favourable to men than it is to women, regardless of race. As of 2021, the rate of unemployment among women is 36.8% compared to 32.4% among men, and when using the official definition of unemployment. And then a further breakdown of these statistics shows that Black women are more affected by unemployment, with 41% unemployment among Black African women, compared to 8.2% among white women, 22% among Asian women, and almost 30% of colored women. This also means that race still remains relevant when analyzing the South African COVID-19 political economy. Overall, close to a third of all people who had jobs in the second quarter of 2021 were employed in elementary and domestic work occupations. Women dominated the domestic worker, clerical, and technical occupations, while the rest of the occupations were dominated by men. These statistics definitely call for urgent policy interventions to ensure better access to decent work and a living income for women. However, domestic workers remain at the periphery of inclusive collective bargaining and earn an income below the national minimum wage. The domestic sector also remains mostly unregulated, leaving many women in the sector vulnerable and without protection. With COVID-19 restrictions, about 250,000 domestic worker jobs were lost, a drop of about 25% according to the quarterly Labour Force survey. In addition, after being laid off by employers, they still could not access the 500 billion relief fund announced by President Ramaphosa due to the fact that most were unregistered with the Department of Labour. Furthermore, some of these domestic workers are also undocumented immigrants and without any form of protection of their rights, and this puts them in the most precarious position in the sector. Domestic workers are also not included in the National Economic Development Labour Council, known as NEDLAC, and remain at the periphery of most of COVID-19 economic recovery plans. According to Stats SA, as of 2021, the domestic sector is occupied by 94.5% of women. These women are also frontline care workers during the pandemic, and under the Domestic Workers Rising movement, has called for several policy interventions that will require employers to provide basic personal protective equipment and suspension without pay, with pay during COVID-19. Informal traders alike, under the South African Informal Traders Alliance, in collaboration with Women in Informal Employment Globalizing and Organizing and StreetNet International, have also launched a Do No Harm campaign calling for a ban on evictions and confiscation of informal traders' stock and equipment. Both these campaigns highlight that the pandemic has indeed had a regressive effect on gender inequality. And this is the context which the Rosa Luxemburg Stiftung and the AIDC bring you the panel, which is titled A Gendered Impact of COVID-19 in South Africa. The panel aims to use a feminist and evidence-based analysis to explore the numerous ways the pandemic interacts with gender, and this includes both social and economic determinants. I'd like to introduce myself. I am Sikolo Tango. I am the Labor Economy Program Manager at the Rosa Luxemburg Stiftung, and I'd like to take this moment to also introduce the panel for today. The panel is facilitated by Untebaleng Morake, a Senior Fellow at Atlantic for Health Equity. The first speaker is Dr. Lauren Paramo, who is a member of the UCT Political Studies Department and of the People's Health Movement South Africa. The second speaker is development economist and current Keda Asmal Fellow at Trinity College, Dublin, Ireland, Tsegofatse Putu. The third speaker for today is Masana Ndinga Kanga, Program Director at Sonke Gender Justice. And finally, Kia Sipata from AIDC will close the event. In addition to this, I'd also like to send my apologies on behalf of Dr. Sayan Brown, who is unable to join us due to a personal emergency. And finally, I'd like to welcome all of our participants. Before we proceed and begin the panel, and for me to hand over to Ndebeleng, a couple of house rules, if I can call them, to go through. Please do kindly, and in fact, it is encouraged for all questions to be posted under the Q&A tab, and please do indicate for whom the question is directed to. All questions will be taken during the Q&A session, and questions posted under the chat tab will unfortunately not be considered. So please do post these questions under the Q&A tab. And thank you so much. I'd like to now hand over to Ndebeleng, who will be facilitating the event.
Thank you so much, Siko, for introducing the event for us. Good afternoon, everyone, and thank you so much for joining us. Our first speaker for today will be Professor Putu, and she's going to be discussing the concept of feminist political economy as it relates to the South African context. Tsuho's presentation will illustrate the relationship between COVID-19 and women's interactions with both micro and macroeconomic economics. Her conversation and presentation today will really illustrate to us how global political economy shapes and drives gender, and also how that becomes a social class production in the South African context. She'll also play out to us how micro levels of political economic power, such as labor regimes and global finance, play out in the micro level of political economic power. So we will also discuss gender economic effects of COVID-19, such as changes in labor relations, as well as gendered impacts, such as gender-based violence. With that said, I'd like to welcome Zilcha to the platform.
Great, thank you so much for that introduction, Deba. I'm quite excited to be here. Let me just share my screen. Okay, great. So thank you very much. I really appreciate that we're having this discussion. I was actually speaking to a colleague earlier about how economics, especially macroeconomics and development policy, doesn't look at the nuances of gender in a country like South Africa, where the integration into the economy has been racially segregated, but also segregated on the basis of gender. So I think that this is a very timely discussion, especially outside leaving this COVID-19 period while transitioning out of it and starting to rethink how we measure development and growth and what that looks like. So I'm going to be speaking today about the gendered economy. And I think that it's important that economics is discussed relative to gender because it's about resource allocation, ownership, and the power to access resources. And we know that women's relationship to resources and their ability to secure resources is at the heart of gender inequality. The South African economy is built on cheap labor through systematic exclusion. And in the case of inclusion, it's usually discriminatory. And we know really that the economy was built around white males having privileged access to resources. And so the place that we find ourselves in right now in modern day South African society is to try to rethink our economy and see and try to understand how we can bring different demographics into the economy more justly. But this is the state of our economy right now, that it is deeply unequal and is also deeply gendered. And I've just written here that the unpaid labor of women and the free labor hours have built the modern day South African society. And just a note before we go on, but I'm sure that this is quite intuitive, that women's positionality and power in the economy and access to resources is not homogenous. There are differences in position and power, and that's something that we need to be cognizant of moving forward. So in my discussion today, I'm going to be breaking it up into two parts. I'm going to, for the first part, speak on the context of the gendered South African economy. And the second part, I'm going to speak on the gendered impacts of COVID-19 in South Africa. And in this first part, I want to address the issue of power. I know Siko spoke in the beginning about informal and domestic labor, and I think that that's a really important aspect. But based on some of the questions that I was sent through by Nteba, what I would like to talk to is the power structure and how women are left out of economic and social power based on our own socialization, but also based on the labor of women not being prioritized. So the care work and the childcare work as well not being prioritized. But also I want to speak to how power is attained. And so I'm going to be speaking to education, and we'll just bring that into labor and employment. And then the gendered impacts, I'm going to be looking at some shifts in labor and employment, childcare, and the cost of gender-based violence in COVID-19. So I hope that this, I provide a comprehensive story that we can speak to, the other speakers can speak to as well. So I think that a very important aspect of challenging inequality in South Africa is through education. And I think a lot of people know that education can really change the trajectory of women's lives, particularly, and in South Africa. It has a lot of ties to the global economy as well, since specific skills get people into industries where they have better access to the formal markets and also the globalized economy. So I have here two graphs. So this is the enrollment ratio for males in public higher institution, and the next one for females. Of course, there are some problematics about male and female and those gender and sex politics, but I just want to highlight that statistics South Africa isn't very progressive and isn't in line with some of the conversations that we're having. So please don't think that it is me. Just wanted to flag that. But yeah, so we see that enrollment into public higher institutions, so not universities specifically, but public higher institutions are varied according to gender and race. We see that white males have, in terms of their gross enrollment ratio by the population of students who graduate, let's say, who leave secondary education, a bulk of them will go into public higher institutions, versus if you have to look through the numbers of colored and Black students who are males, much lower percentage of that population group enters into public higher institutions. So the point of this is to just show already if we have to look at public higher institutions and the people who are really challenging power in the country, we can already see the discrepancies. In terms of women, we see that white and Indian women, their numbers are quite high. If you have to see the ratio there, that will enter into public higher institutions. So that's public universities, TVETs, etc. And if you have to look at the Black and colored population, you do see, I would say that the ratio, if we had to take a closer look at the data, is that women in these communities or in these demographics are likely, contrary to like what we learn, the woman population who do get to the end of their studies and do go into university is likely to be higher than that of males, which might be against our immediate intuition. But yeah, this is what's happening. So the point of the slide is to show that there are discrepancies and already inequalities at this stage where we're starting to think about elite power in South Africa, right? But if we have to also take a further look at access to and so institutions and the major fields of studies, what we see is that a lot of men end up in science, engineering, and technology, while women are more likely to go into education, which really is like external, so outside of household, but like external childcare as well, right? So this, I hope that this is in line, that you're already setting up men into more positions of power where they're able to gather more resources, and women are really doing extended socialized service and extended care work in a different realm of the economy. But we can already just see that in the university space or in the place of like skills development, we can already see how the allocation of power from there is changing, and how that is all happening. So I thought that was a very interesting indicator that just from the onset of those who survived the basic education system in South Africa, when they come into this space that is supposed to change the trajectories of power, what happens and how power is allocated from there. So I thought that was a very interesting slide. So moving on through education, we see the job market for women specifically. And what we see is that women are concentrated in community and social services, but also a significant amount of women are in the private household, which is something that we know is quite intuitive as well. And when we see what happens in COVID-19, this really helps to put into context why women specifically have had an unequal experience of COVID-19. So so that introductory part was just to speak about the South African economy and also speak about power sharing and how power is accumulated. And I looked at higher education specifically to speak to how even at the top level of I would say people who end up accessing higher education end up being the elite. So even at the elite level, before we look at all other levels, we already see how power is allocated to men, and men specifically who are white and who are essentially white. So the system keeps on replicating itself. So if we have to look at the gendered impacts of COVID-19, we see that in terms of employment, women experience greater job losses in relative and absolute terms. And this, based on the first slide that I've shown, makes sense. A lot of community and social services will be face-to-face, will be interacting with other people. And so COVID-19, this health crisis, was to do with contact and isolating contact. So a lot of those jobs, unfortunately, were jeopardized. So women's jobs became precarious. And of the women who did keep their jobs, a lot of them were in the front line and were most exposed to COVID-19, right? So we're talking about our cashiers, our nurses, our people who have to continue working in direct contact with the virus and people who might have the virus. So we also saw that there were 2.2 million job losses at the initial level 5 lockdown. And of those 2.2 million job losses, women lost 2/3 of those jobs. So just under 2 million job losses were women's jobs. And these were mostly in the service and agricultural industries. And what we also saw is that as the different adjusted levels came into place and things opened up and closed and opened up, women's income remained 8.4% below pre-COVID-19 levels. And this was a statistic that was produced in March 2021. And it just shows that women's economic recovery was slower, whereas this data that I've gotten from the National Income Dynamics study shows that for the same time period, men had recovered, so their income was very similar to the pre-COVID-19 levels. So we already just see from employment and income, women have had a unequal experience of COVID-19. In terms of hours worked, employed women had bigger declines in the average hours that they worked. We saw that from February to April 2020, which would have been the first lockdown. Hours worked decreased by 35% for women and only decreased by 26% for men. And part of this was driven by a lot of people who lost their jobs but didn't go into work. So that would have affected the average. So as Siko spoke about in the beginning, like people who would work in the home, so like domestic workers, would still have a job, but would be working 0 hours. And their income would be adjusted according to that as well. So they'd be registered as employed, but with not working any hours. And that's what we saw across the service industry for waitresses and waiters and people who do work that is registered but could not go to work. And I think another interesting aspect was the unemployment insurance fund. They had a temporary emergency relief support, I think it's called. And what we saw is that although women lost the most jobs the most recorded jobs in COVID-19, women were underrepresented in receiving this UIF support. And women accounted specifically for 34 to 39% of the beneficiaries of the UIF support that was given to businesses to ensure that they didn't let go of staff, and was also just given as support to people who had lost their job already. And I think that this is something that is really problematic and will also, I think, make sense on this next slide as well, just the understanding of how policy has worked in South Africa. But another aspect of job support that has come out of COVID-19 is the COVID-19 Social Release of Distress Fund. And what we saw is that in June 2020, so this fund was announced in May 2020. So in June 2020, in the first group of people really who had signed up, and the first 2.5 million recipients, women only accounted for 38% of the people who received the COVID-19 fund. And this is the 350 fund, or the 350 grant, for anyone who doesn't know the official name, while men made up 62% of it. And in January 2021, out of 5.4 million recipients, women made up 35% of the recipients. And men made up 64% of it. And this is in the context of women being the demographic that have lost the most jobs. And this, I think, highlights something very specific in our policy in South Africa, and the fact that it's not nuanced and that gender isn't accounted for, because, or isn't paid attention to very well, because the Social Relief of Distress Fund is a grant that was given to all unemployed people who don't receive other grants. But a lot of women were discounted from receiving the grant because they received the child support grant. And so it was assumed that since women received the child support grant, that other grants would not be needed. But we know very well from other studies that have been conducted that a lot of women use the child support grant for feeding their kids. That's what it's for, you know, and providing other resources for care and nutrition for their kids. And so because of their caring responsibilities, women were left out of receiving other income supports that were important. And on some stage, there was a caretaker's grant that was for 500 Rand for people who take care of children, but that was only for, you know, per household who have children rather than per child. So what we saw is that the child grant, which is already below the food poverty line, was not being supplemented in the way that we would have thought, right? During this time where a lot of women had lost their jobs and were not receiving the Social Relief of Distress Fund, but were also only getting a very limited additional 500 Rand per caretaker for 6 months. You know, so yeah, that I think the Social Relief of Distress Fund really highlights a lot of the problems that we have in terms of grants, in terms of attitudes of policymakers towards women in households and care and the cost of the care and women's relation to children and welfare, I'd say. And this is an important reason why there's a call for basic income grant or basic income guarantee that is unconditional for all South Africans between the ages of 18 and 59 years old, because then we can avoid these issues where women who do need grants will be excluded because they receive other grants. Okay, in terms of childcare and unpaid work, we saw that women took on more unpaid care hours when schools closed down. And so children could not leave their homes, but also they couldn't get assistance from domestic people who work as domestic support in their homes. So women who were either still employed or became unemployed had to take on more unpaid care hours. We saw that 75% of women who do have children were living with children aged between 5 and 17. So these would be school-going children who had to stay in the home. And when we took a closer look at that statistic as well, of the women who had children, 50% of them had children who were in the ECD stage. So that's an early childhood development category. So these are children between 0 and 5 years old. So that is, women had to really take on the care of very young children during COVID-19, alongside the work that they are doing or the work that that they might have lost. And then we also saw that on average, both men and women reported that they spent an extra 4 hours a day on childcare, which I think makes sense considering a school day is 5 to 9 hours. So that all of those hours had to be absorbed by other people. So households absorbed that extra 4 or 5 to 9 hours had to be reallocated into the house. And as I've said, women took on the responsibility of care. So yeah, that would have been what happened during COVID-19 and the shifts in care and what women had to go through. And yeah, so this is my last slide. So I wanted to include this slide because I think that it was a big issue for us as a country. The cost of gender-based violence. So there aren't a lot of there's not a lot of economic studies or measurements that look at gender-based violence and its cost to the economy. But KPMG in 2017 did a report on gender-based violence, and they estimated that it costs between 0.9% and 1.3% of GDP annually, and that's about 28 to 42 billion rands a year. And in COVID-19, I think that might have been expanded because we saw increases in gender-based violence because people could not leave their homes. And so people were in the same space for many hours. And we know that living conditions across the country vary on top of multiple other issues, so unemployment and having resource deficits. So this created a lot of turmoil in households. And just thinking through some of the effects on the economy, the increased gender-based violence, especially at a time where national resources were diverted to hospitals. We know that gender-based violence added a burden to public health and private healthcare and reduced capacity for other priorities, including fighting, the virus and people who were ill with the virus. Also, lots of government expenditures were used to respond to victims and survivors of violence, including the police, social services, housing and shelter services. And this really took away resources from addressing the issue of COVID-19 to addressing the issues of violence. That is a cost to the economy. Effects on aggregate supply were that women who suffered from domestic violence had lower abilities to turn up to work on time, to work productively. There were huge challenges with their mental health, which is not costed, but that affects their life significantly. Also, the link between experiencing violence and lower earnings. So that, and also not being able to work the same amount of hours as you would if, your mental health was in a much better place, or if you were mentally healthy. So yeah, women's or just gender has affected COVID-19 significantly. And I think that the pandemic has been a huge eye-opener on how not looking at the nuance of gender can really make a whole demographic of productive people and productive labor in the economy fall through the cracks because not enough allowances or thinking is done around making sure that women are supported and that women are not discriminated in their quest to, doing better for themselves and working themselves up in the economy, or making sure that the economy takes care of them, or they have a good shot at whatever their aspirations are. So yeah, that was my presentation for today, just highlighting how women's care and productivity is overlooked, although it's just as valuable as any kind of productivity, and how women's care has supported the functioning of the South African economy. And yeah.
Maybe it is the same, the community radio engagement.
Yeah, so that's all. We need to get our policymakers thinking about women more, and we also need to, as economists and development practitioners, need to start thinking along the gendered lens and expand and rethink how we understand economics, especially in South Africa. That's all from me.
Thank you so much, Tseho, for the presentation. Tseho really has illustrated to us how the COVID-19 pandemic has really pointed a spotlight on the vulnerabilities of individuals from whom the gains of capitalism are extracted from, and that these have devastating economic and social and even health effects for all of us. Tseho's presentation has also showed us that the pandemic has exposed fault lines of existing economic, political, and social systems. She even just mentioned now that it's important then to advocate for and urge policymakers to rethink some of systems in place currently. And because these really do cause disparities of power within lived experiences of men, of women, and marginalized people across the board. So I think my question then would be, following your framework in your introduction notes on the concept of power, could we then say that gender oppression in the context of COVID-19 was then partly produced and reproduced continuously throughout the year by systems of capitalism?
Definitely, yeah. I think that the reason our South African economy is the way that it is right now is because of how it's been integrated into the larger capitalist system. Even the idea of globalization that is spoken about very often, if you do not have skills, your integration into the global system is very different from those who do not have skills, So if you do have the skills that the global economy is looking for, then your integration is different. But what we've seen in South Africa, and as I've outlined in my presentation, the skills that women versus men have, because of many reasons, because of socialization, because of access at basic education, etc., means that systematically men and a certain demographic of men have a better shot at doing well in this globalized economy versus everyone else. Their power doesn't become as, it doesn't replicate itself in the same way as other demographics. So yeah, that's what I would say. I think it is definitely a function of capitalism and capitalist integration.
Thank you so much, Tseho. If you guys have any questions for Tseho, please note them down. We'll take questions in the comment and answer section of this panel. Our second speaker is Dr. Lauren, and she will focus on the social determinants of health and COVID-19. Her presentation will explore the structural drivers of health inequities in South Africa by illustrating how social, economic, and political inequalities shape and influence healthcare and health outcomes. The presentation will address numerous questions, including how South Africa's chronic inequality and I guess systemic inequality influenced health outcomes during the COVID-19 pandemic. She will also help us understand how gender is a social determinant of health. Dr. Lauren will also explore that in the past year, what have we learned about the politics of COVID-19 vaccinations, and how these then compare to the politics of HIV and AIDS treatment that we've seen, I think, in the past 20 years, especially in the South African context. With that said, I'd like to welcome Dr. Lauren to the platform.
Thanks, Ntebaleng, and thanks to AIDC and Rosa Luxemburg Foundation for organizing this important event. I'm not sure that I'm going to be able to cover all of the themes Ntebaleng flagged in a systematic way, but let me try and speak broadly. So I'll start with the concept of health, because I was asked to speak about health in relation to COVID-19. And so maybe as a starting point, it would be good to say that, when I speak about health, I take the World Health Organization definition of health, the definition that's contained in the Alma-Ata Declaration of 1978. And that's a definition of health that says health is more than merely the absence of disease. So health is a state of total well-being. Health is a state of flourishing, effectively. And so I think it's clear that if we're speaking about health, South Africa for a very long time, perhaps since the inception of kind of colonial South Africa, definitely modern South Africa, has been an unhealthy society, and that the burdens of ill health within that unhealthy society have been distributed unequally. And I think historically those burdens, the effects of poor health outcomes have disproportionately fallen to working class Black female South Africans. And of course, those dimensions intersect in very particular ways in South Africa. So that's the first thing to say. The second thing to say is, Ntebaleng mentioned the fact that South Africa has been defined by a history of inequality. And I think this manifests very starkly in South Africa's health system. So we all know that the health system of South Africa is made up out of a private sector that services about 20% of the population and absorbs about 60 to, by some estimates, 80% of health spending. And the rest of the population, so the 80% of the population, depends then on a chronically underfunded public health system. And so I think one of the things to note about that inequality is, of course, generally it means that people that use the public health system are systematically disadvantaged. They have less access to care. The workers in the public health system are overstretched. But I think also there's a gender-specific point to make about the public health system. And that is to say that, in the context of South Africa, the public health system has historically invested in tertiary care or hospital level care. The bulk of its resources have historically been invested in that sector. And primary health care has been neglected for much of South Africa's history. This changed after 1994, and particularly from about 2011. But the point stands that primary health care has been poorly resourced for most of South Africa's history. So I mention this because I think, if we think about it from a gender perspective, one of the main points of contact that the public health system has historically had with women is through reproductive health. So again, this is the management of women's bodies for the purposes of reproducing the population, and particularly the labor force. And also during apartheid South Africa, some of the kind of investment that the apartheid government made in the primary healthcare infrastructure during the 1980s was in reproductive healthcare, and particularly birth control infrastructure. And so I make this point to indicate that if in general Black South Africans' contact with the public health system has been one of vulnerability, so people not always feeling cared for and safe in the public health system, one of persecution. So in the context of the 1980s, for example, activists being handed over to the police when they present at public health institutions for care. Then for women, historically, and Black women in particular, the public health system has historically played a significant role in managing their bodies, their reproductive health. And of course, we know that's related in the context of apartheid South Africa to concerns about demographic growth of the Black population relative to the white population. So I think in the context of that, we then have to think about what health means in South Africa and how you craft a health system that really looks after the health of women. And by health, I mean more than just reproductive health. So how do we think about the health and welfare of women, generally speaking, from a public health perspective? And I think one of the things that COVID-19 has shown is that very little thinking has been done on this in general. I think with COVID-19, what we're seeing, in fact, is a compounding of many of the vulnerabilities that have long existed in the public health system. And it's resulted in, for example, women having less access to services like birth control, but also services, for example, like emergency care services for sexual and gender-based violence. So that's one thing to think about. I think also in terms of the history of inequality in South Africa, the other thing to think about, and this is true of the public health system, but also of social services, more generally public services, is that particularly since 1994, there's been a chronic underinvestment in public sector services. So with respect to the health system, we know that after South Africa's transition to democratic governance, there was a massive explosion in demand for health services, and that of course is connected to the HIV/AIDS crisis that South Africa underwent when numbers escalated quite rapidly by the mid-1990s. And so one of the things that happened in that context is that the government tried to make available services. So treatment eventually became available, but also kind of managing symptoms. But especially with the rollout of ARV treatment from the mid-2000s onwards, what we saw is that the chronic underinvestment in the public health services led to a situation where women were expected to take up the shortfall in labor in the public health service, and particularly labor in terms of facilitating people's access to ARV treatment. And so, of course, we know that this is done by employing community health workers, often initially through extended public works programs, that these community health workers made incredible contributions to boosting access to HIV/AIDS services, but also maternity and child health services in particular. But we also know that this kind of task shifting that happened partly in an attempt to manage costs in the public health system had really exploitative effects, right? So we see an increase in availability of services going hand in hand with the exploitation of female health workers, in this case, community health workers. And these, for the most part, are Black working class women, quite often elderly women, that have struggled to gain access in the so-called formal labor sector. And so, of course, we see that this labor force is still with us today. We see that quite often these frontline health workers, the typical situation is still what it was in the 1990s, that women are underpaid, irregularly paid. They don't have access to basic protective equipment, that the government goes back and forth about improving their conditions of employment or recognizing them as a formal part of the public health system. But again, in the context of the COVID-19 pandemic, relying on community health workers as the kind of frontline health workers that are made responsible for educating the public, putting people in contact with testing centers, isolation facilities, and so forth. So the one point, I guess, that I want to make is that the South African health system has not been a health system, it's been a disease system, and for much of its history, including after 1994, based on the exploitation of Black working class women who have been underpaid, not paid, and marginalized within that system. I think connected to that, and this is something that probably Kia from AIDC is better positioned to speak to what we're seeing in the context of COVID-19, is the government making an argument that it cannot afford to pay public sector workers decent wages. And so now we're not only speaking about workers at the lower level of the occupational hierarchy, but all public sector services workers. This would include teachers, nurses, healthcare professionals. So really people that are at the forefront of, one, in the case of medical professionals, providing services that help to protect us against COVID-19 and its effects. But two, in the case of teachers, ECD workers, who also are largely invisible class of workers, workers who provide services that subsidize effectively women, because women, for the most part, are responsible for social reproduction work within the household. So where children are able to go to school, for example, it frees up the labor time of women. It gives them the capacity to spend their time doing other things, whether it's studying, working for money, relaxing, doing political organizing. And so what we're seeing in South Africa is a kind of intensification of austerity politics with respect to public sector wage negotiations. That austerity politics is likely then to compound the already constrained availability of public services that help to alleviate some of the social reproductive work pressures that weigh on women. And as AIDC has indicated in its application, its amicus application to the Constitutional Court, this kind of austerity argument is made under the guise of protecting the needs of the poor, the wage bill being too high, and so wages need to be constrained in order to ensure that the poor can have their needs met through various social services and so on. But in fact, this is a false distinction, right, between paying people who provide public services decent wages and meeting the needs of the poor, because actually these things go hand in hand. And then maybe something to say specifically on the health sector in the context of this conversation, that it's especially worrying that the government in its most recent budget has indicated that spending on health will effectively be decreased over the next few years. So that's on, so I've done the health system and its contact with women through reproductive health policy, but also exploitative labor practices. I've said something about austerity and the rolling back of public services generally, that to some extent, not as much as we'd like, assist women or subsidize some of the social reproduction work that gets outsourced, the task shifted to women within the household. And then maybe the final thing to say is that, as with the HIV/AIDS epidemic, we're seeing in the context of COVID-19, again, massive struggles for access to vaccines, medicines, therapeutics, diagnostics that are needed to save people's lives. In the case of COVID-19 vaccines, they're safe, they're effective. It's not like these technologies don't exist. But what we do see is that we're in a context where the global architecture that governs trade, and specifically the TRIPS framework, restricts the sharing of intellectual property that would allow more companies, more countries to manufacture, in this case, COVID-19 vaccines locally. And this is leading to massive inequalities in access to vaccines between the global north and the global south. And I mention HIV/AIDS because the struggle being fought today for a TRIPS waiver, for example, for a shift towards local manufacturing in the global south of essential pharmaceutical products is exactly the same fight that was fought by HIV/AIDS activists in the early 2000s. They at that time secured the Doha Declaration, which indicated that IP rights under TRIPS should be waived in the context of public health emergencies. But we see that this has not happened. And so I think, to tie back to the concept of social determinants of health, so just to pause, social determinants of health referring to the conditions in which we are born, grow, live, age, work. These things shape our health outcomes, and specifically, things like money, power, and resources shape our health outcomes. So, the point about the TRIPS waiver and the intellectual property rights regime, I think, is a point about the ways in which the absence of the global south in decision-making structures about trade in institutions that govern the political economy of health, and particularly the absence of women in these decision-making structures, then creates a global political economy in which the right to health, the right to a total state of well-being is explicitly and persistently neglected. And at the same time that there's a kind of voracious extractivism of women's labor, where women get relied on to serve at the front line of the COVID-19 health crisis, whether in a kind of formal position within hospitals and clinics, or in a less formal public space like the household, where women disproportionately are responsible for caring for the sick, for children, but also generally for other members of the household and the community. So I think that is all I wanted to say. I leave it at that, and then maybe if Debaling wants to draw out anything else in terms of what I haven't said or what I said but maybe was a bit rushed or unclear, then we can cover that in the questions. Thanks.
Thank you so much, Lauren, for that. Lauren's presentation has really illustrated to us that gender inequality leads to health risks for women, for men globally, and in South Africa specifically. She's also illustrated to us how addressing these gendered norms and roles leads to a better understanding of how social constructions of identities and unbalanced power relations between men and women has effects on risk, health-seeking behaviors, and health outcomes for men and women in different social groups and social settings in South Africa. I guess my question, based on, I think, what you've highlighted on the challenges of the healthcare sector in South Africa, and we've seen massive corruption and various other challenges. Do we think that that could further contribute to a commodification of health on top of what we currently see? So I think that's my first question. And my second question, I think, then leads to what response do we make, or what connections can we make on, I guess, the concept of masculinity, the concept of doing masculinity, and men's hesitation to getting vaccinated. Could we say that also becomes then a form of performing masculinity? Yeah.
Okay, so on the issue of commodification of health and corruption, so South Africa is trying to institutionalize an NHI, which would unify the health system and presumably make sure that resources for health are spent not only rationally but fairly, so that we cross-subsidize the health needs across age, across class, across urban and rural divides. And I think that's a good thing, right? Similarly, I think it's a good thing that activists are calling for local production of pharmaceuticals in the global south. That said, I think in the context of neoliberalism and in the context of global elites, but also domestic elites that have a vested interest in accumulating whatever resources they can. I think both of those policies, there are risks that we need to be alert to, right? So if we do have local production of pharmaceuticals, how do we make sure that it doesn't follow the model of global pharma, which is profit maximizing? How do we make sure that it's publicly owned, that medicines are priced so that it's affordable for the public sector, and also that investment is made in medicines that actually are needed by the population, not necessarily medicines that are most profitable to sell domestically or on the continent. Similarly with the NHI, I think, the way it's structured at the moment, the NHI allows for private sector providers to be designated care providers. And so while it's good that there's a solidarity fund that is being, NHI fund that is being created in order to subsidize more equitable access to good quality health services, even there, it's not clear that that will work against the commodification of health services if the NHI fund goes to private sector providers for the most part. So I think, as with something like the right to health, as with something like the NHI or demand for local manufacturing, these things, so there's the policy and the legal version, and then there's how it plays out on the ground. And I think how it plays out on the ground depends on how well organized we are as activists, as civil society, that organize for the most just version of those things to be institutionalized. In terms of masculinity, I think, so we know from COVID-19, we know from HIV/AIDS that men generally are less willing to seek healthcare than women. I suspect it's not my area of work, but I suspect it is tied to a performance of masculinity that discourages men to be vulnerable. But I think also there's a broader conversation to be had about whether people feel like they are cared for when they go to health institutions, and that's men or women. And that's public and private institutions. And again, I think, to tie back to your first question, perhaps that has to do with the pressures of running a health service that is supposed to sell health products, and health becomes a commodity. Or even if it's not a commodity, if it's produced not for profit, that workers in, let's say, the public health sector under a lot of pressure to move patients in and out efficiently to do what they can with limited resources. And so the point at which someone comes as a patient in a state of vulnerability, the nurse might not have the energy or the time, and for good reason, to spend the hour that you need to be counseled into taking a vaccine. So I think there's a way to look at it as kind of an individual performance of gender, but there's also a way to look at it that there's a kind of bigger structural context that makes certain performances more reliable in protecting yourself given the constraints you're facing, as a man or as a woman or as a worker.
Thank you so much. I'll then now introduce our third speaker, Masana, who's going to be talking about effective policy gender making as a means of addressing gendered systems of oppression, particularly in times of crisis such as the pandemic. Masana's presentation will help us understand how mainstream economics suggest that COVID-19 and its impacts can be read outside of the system of capitalism. And I think Ziho really began doing that work for us, and Lauren also further emphasized on that. So my presentation will make us understand what we mean by feminist policy making and how that process looks like. She'll also make us understand how existing national policies contributed to making the pandemic's impact better or worse for women and marginalized people in South Africa. I will hand over to Masana for us.
Thank you. Thank you so much, Ndebeling, and thank you so much to our previous panelists and for colleagues for having me in this space. I mean, this work now today is, and having this opportunity for a reflection, I find quite significant on the backdrop of the organizing that feminists had done last week under the Code Red Feminist banner, which for me is a really encouraging departure point around moving away from our institutional mandates and into sort of this organic or organizing work that characterizes where a lot of shifts happen. And so I'm really excited to be in the space with you. And I want to start with a quote, which is from Femnet. And I'm such a fangirl for the work that Femnet does. And it's really around sort of the role of not just feminists, but women in the economic policy discourse and the discussions that are taking place across the continent at the moment. So bear with me whilst I read. The quote is directly from their website, and they say, with regards to women's economic empowerment, there has been a trend to relegate the issue to micro-level economic analysis and intervention. With regard to macroeconomic policies, they have been insufficiently focused on employment issues and enhancing existing livelihoods, which is proving to be not enough. Femnet believes that instead women's economic empowerment must be understood as far more than women's ability to compete equally in existing markets or as the beneficial outputs of their contribution to growth. It must include women's access to and control over economic resources, access to decent work, emphasis on decent, control over their time, and meaningful participation in economic decision-making at all levels, from the household to international institutions and the policy space. And I think, isn't this what we see when people talk about women and women's engagement in the economy, and even those who exist outside of the binaries, is that we're oftentimes either victims or beneficiaries of the policy process and not engaged as full humans within that space. Furthermore, not only that, we're positioned as contributors. So the benefits of engaging in feminist policymaking or gender just policymaking is that it contributes to growth, right? And of course, we know that there's so much richness and nuance in completely disrupting the entire system, which is what we want. We're tired, we want change. And so what is the policy crisis of our time? I think, you know, I joked in a panel a few weeks ago that I'm pretty sure that all journal articles 2020 to 2021 will start with the COVID-19 pandemic has laid bare the existing fault lines of our times. But indeed, you know, it's not necessarily that COVID in and of itself has contributed to heightened inequalities, but rather it's laid bare, I think, the complete ways in which the expansion of neoliberalism and the stripping of provision of social services, as Lauren and Tshofatso have elevated, has stripped away access to social services, access to just livelihoods and meaningful participation for the majority of people across the world. I think even looking at the unemployment statistics of South Africa and how Black women in particular are disproportionately affected by unemployment points to the ways in which COVID-19 has elevated these inequalities. So, I mean, the truth is, and I'll speak a bit more to this, is that, of course, the policy crisis in South Africa in particular is that we have a wonderful language of social justice in our policies. I'd just done a bit of research for Pathfinders on racial justice policies in South Africa. And what's really interesting for me is that the language includes words like decolonization and feminism and equal participation and social justice, right? So the state definitely knows the language that we want, but when it comes to resourcing and implementation and moving beyond around talk shops, there's a gap and a crisis. And furthermore, what you see is that, of course, with the wonderful Bill of Rights that we have, bringing the state to the table is in particular a challenge. There's been a case, for example, of successful litigation against the state for the provision of water and the ways in which access to water disproportionately affects Black women in our country. And despite the finding in the court, the state has been reluctant to implement the recommendations from the court. And I think this is the crisis of our time, is that before, we knew that mobilization could bring the state to the table. When mobilization failed to work, we moved to litigation, which in and of itself is an elite process of change, right? You need resources and at least a legal background and someone who's admitted into the court to be able to litigate on behalf of social justice matters. But it's largely devoid from this collective action and this collective language that is necessary for discursive and practical shifts in policy implementation. And now that litigation is failing and the state is not even implementing the recommendations of the court, what then is left for people to do? And I think this reminds me of the paper by the Center for the Study of Violence and Reconciliation called The Smoke That Calls, which came out, I think it was around 2012, which looked at sort of the crisis of legitimacy and engagement and effective policing to cull public violence and mass mobilization, right? And that oftentimes what we see is that mobilization becomes violent or exacerbated when it relates to service delivery protests and not presidents going to jail. So I'm excluding that, but it escalates and becomes violent because there is this innate knowledge that you are likely to have a member of public service or the government appear at your protests and heed to your demands in the instance of a destruction of public property, right? And that leads to, in and of itself, a crisis of legitimacy, of meaningful democratic participation. There's also, I think, a very real challenge of the political economy, both nationally and globally, which will be the focus of my presentation. I'm talking very fast because I have so much to get through. And then, of course, as has been mentioned, the social services crises, unequal and under provision of social services. So it's not just that social services are not being provided across our country, but that based on your class, which is largely determined by your race and your gender, and your ability status and your sexual orientation, that you are more likely to be on the receiving end or of less than just access to social services. And so we don't want the minimum human rights core in provision to services, which is, have you seen a water tanker in your community in the last week? What does it mean to have dignified access to social services, access to sanitation, access to water? Oh, there we go. Sorry. Oh, there. So of course we know that because of neoliberalism, the state is vulnerable to shocks. I don't know if any of you recall, but as the pandemic was rolling out in South Africa, we received a downgrade, in and of itself a problematic indication of where the global political economy is and what it prioritizes. And of course, the rand weakening against other currencies. I think this vulnerability is then compounded by large state bailouts to SAA and Eskom and high levels of corruption and illicit financial flows, not just in South Africa, but across the continent, amounting to roughly $50 billion annually. Combined with this, our fluctuating exchange rates, the reluctant lowering of the interest rates, which eventually happened, the high levels of unemployment and the false dichotomy that's put forward in the policy sphere between the unemployed and the working class, as though increasing access to dignified wages in and of itself would contribute to unemployment. And so our crisis isn't actually that the working class is demanding higher wages and the so-called cost of our labor, right? So the commodification of the labor becomes expensive, but rather the real crisis, and this is where it's smoke and mirrors, is that in the event that we were to put forward a strong policy position that puts forward dignified wages, there would be large levels of capital flight in the face of tax, of trade and tax liberalization. So we know capital will move quickly towards places where it's able to consolidate its power. Of course, you know, a matter very close to my heart is the continued invisibility of care work and social reproduction that subsidizes the extraction of labor within our economy. And then, of course, the criminalization of the most vulnerable in our society, cough, cough, Cape Town, and the criminalization of those living in homelessness at the moment. But this is not to say there are gaps, right? So as I mentioned, South Africa's policy framework is really progressive. But further than that, the social welfare system is one of the farthest reaching in the continent. Of course, we know we have the child disability, old age grant, we have unemployed insurance, housing subsidies, and the RDP, which targets roughly 12.4 million people. But of course, what we see within that is that there's large populations that are missing, as was captured in COVID-19 through the social grants that the state rolled out, which were largely exclusionary in the absence of litigation, which included casual workers, domestic workers, and foreign migrant workers in our country, who also then contribute, right, to this very measure that the state itself champions of GDP growth. Furthermore, the system in and of itself does not capture young people in its provision of support. Migrants, as I've mentioned, and sex workers, again, part of some of the most vulnerable in our society. And this has led to this push for a basic income grant as part of the transformation of the economy. Now, I think that when we then look at the National Development Plan, the National Health Insurance, the National Strategic Plan on ending gender-based violence and femicide, and the National Action Plan to combat racism. I mean, these are all really beautiful policies, and oftentimes the questions of affordability and the ways in which the state is making decisions around the economy come into play. And on the one hand, in the face of large levels of corruption, the implementation of these definitely shows where the state is putting its priorities. But on the other hand, we then have to talk about the global political economy. Right, and we cannot think about sort of the capacity of a state to implement progressive policies in the absence of the global political economy. And I have some nice pictures there, which I won't speak to because I think they capture the essence of what I've written. So we know for a fact that multinational corporates supersede the economic powers of the state. And what I mean by this is at any given moment in the context where corporates and individuals have higher income and wealth resources available to them than states themselves, then there's an imbalance of power that determines the policies that get made at a national level and at a regional level, right? And we know that through the funding of political parties and the influence of state priorities, that this in and of itself is a crisis. We see amongst this, right, even with COVID-19, the rise in the concentration of wealth through global value chains that push the cost of capitalism onto the most vulnerable, right? And that I won't speak very much about this, that through trade agreements and hegemonic application of TRIPS, as Lauren has spoken to, that really ultimately the ultimate driver of the interest in the global political economy is maximizing wealth. There's also an instability created through conflict and profits that are earned through arms deals and the proliferation of war across the world. And the focus on economic growth comes at a cost. If not in country, then this is externalized. And I think this is important then when we look at the African Continental Free Trade Area that came into force on the 1st of January, is that much like Rwanda externalized the cost of its massive economic growth and development onto the Democratic Republic of Congo by pillaging that country. South Africa in and of itself is expanding into the continent through I won't mention companies, but retailers providing goods and services across the continent and undercutting the very necessary economies and industries that sustain the livelihoods of predominantly Black women. So when we look at regional integration and solidarity, and we're talking about feminist economics, we can't just talk about our country in isolation. We need to look at the bigger picture. And of course, you know, when we look at the African Continental Free Trade Area, we know that it is largely gender and ability blind, and it maintains colonial boundaries and continues the neoliberal agenda through the removal of 90% of tariffs that benefit the regional giants such as South Africa, Kenya, Nigeria, and Egypt. I'm sorry to the conveners, I don't know how much time I have because I'm looking at my screen, so please stop me if I need to stop, but I'm running. So what does this mean? And I love this work of imagining our collective feminist futures. And I'm glad that Donna Andrews is also on the call, who's also been a large part of my thinking around this, right? So when we look at that original quote, we see that our current approach to economic policy sees humans as a point of intervention or beneficiaries, more often as victims when they fall outside of the gender binaries of the economic process. Feminist economics introduces to us the humanity, the radical humanity that prioritizes the well-being and the justice deserved by all and moves us beyond growth. So a social justice-led economic approach becomes critical to our way of working. Oftentimes I hear, when I speak about this, these matters, including the universal basic income grant, is that, well, innovation will suffer because people only create things because of innovation and because of capital and being able to make more money. But researchers actually indicated that this is a huge fallacy. In fact, innovation is usually facilitated by huge amounts of public investment. There would be no Facebook and no iPhone without large investments from the government. It's the same case with the development of COVID-19 vaccines. And of course, as we've seen in the case of the J&J vaccines in South Africa, this innovation at a global level is usually facilitated by huge amounts of exploitation and lack of accountability. Our current calculations of GDP also fail to include care work, with large ramifications for the well-being and recognition of work that is not monetized, but contributes directly to the growth and exploitation of many in the economy. There's also limited information on remittances, and I'm going to do a shout out and a plug to myself. I did a documentary series called Triple Jeopardy that looks at the Black middle class in South Africa and shows in and of itself that this economic concept of households being isolated units that exist, for example, in urban or in rural areas is a fallacy. In fact, for the majority of people within the Black middle class in South Africa, at least those who responded to the survey, instead remittances connect households across geospatial locations, class divides, and oftentimes it is the work of remittances that does the real redistribution and provision of basic income to many households across the country. I also want to prioritize mass mobilization as a critical point of enabling not just the popularizing of this language of the policy demands, but also to the ways in which we're able to push back at the system, against the system. For example, in the last 3 years, austerity measures have been rolled back because of this mass mobilization, for example, in Lebanon and in Chile, led largely by the feminist movement. And at a time when 80% of IMF loans provided for COVID-19 include austerity, then we need this collective action. We also need to ask, who is this growth for? Who is it serving? Imagination is a luxury. And so I really encourage those on the call with resources to facilitate spaces for a collective imagination to make this real. I have a lot of other lovely words that I can say. I'm happy to share my slides as well. But I want to say, like, from a policy level, feminists have done this work of imagining exactly what policies are needed across each of the spheres and the ways in which they speak to one another to enhance our collective humanity and dignity. At the individual level, this includes just livelihoods, including redistributive justice, just access to services and not just the human rights core, civil and political rights, including the right to protest and mobilize and freedom of expression, bodily integrity, the right to play and the right to rest as critical feminist responses. At the household level, this includes access to quality care, services, food and social security, collective socioeconomic rights, including housing and land rights, recognition of inter and intra-house remittances, and stronger links between the unemployed and the employed. At the national level, this includes an end to illicit financial flows and historical debt obligations. We do not want debt forgiveness, we want debt justice. Monetary and fiscal policy that regulates capital flight in solidarity across the global south, exchange rates and volatility, participatory budgeting that prioritizes just livelihoods, climate justice and non-financialization of social services rather than growth. And this is going to be my last point. At the global political economy level, what we want is greater accountability opportunity for tax havens, and there've been some massive moves in that end, but to the benefit predominantly of global North countries, an end to harmful trade policy, resource extraction, and we need better policies for global value chain management that affect livelihoods, and global South solidarity for just and feminist economies. I will stop there because I don't know how much time I have. Thank you so much.
Thank you so much, Masana. Yeah, I think Masana has really illustrated, I think something that really comes out quite a lot for me is this idea of the invisibility of women, of young people, of other marginalized people in policy, and how that feminist organizing undoubtedly does impact on policy, and that we need to be challenging then this marginalization and erasing and invisibility. And I think in certain cases, the hyper invisibility of women and of marginalized people, and just finding the right balance where there isn't a form of like tokenization, but the people in which the policy speaks to are really, really illustrated in their fullness, in their vastness, and in all the different nuances that they show. My question, I guess, for Masana would be then, what feminist tactics for social organizing can we employ as activists to challenge this concept of invisibility and, in certain cases, hypervisibility in policy?
Wow, that's such a good question. And part of my feminist praxis is admitting when I don't know the full answers, right? So I don't necessarily know that we've reckoned with the two ends of the spectrum. As part of, the past few weeks organizing a picket and a protest, what I have noticed is when we do apply a power analysis, it becomes critical for us to take turns to rest and take turns to show up. As we see across the world that there is this heavy crackdown on feminist activists and feminist mobilizing and organization, we have to realize that part of the ways in which capitalism works is that it identifies a spokesperson, a champion, and a leader, and then uses the infringement on civic freedoms to crack down on that individual. And now more than ever, we need to step away from sort of the spokesperson or leadership model and move back into our horizontal forms of organizing, and look at some of the ways in which sort of the invisible care work that we do as feminists amongst our community becomes critical for sustaining one another, right? And so that for me is a type of care work that is not seen, that is so critical because it's part of that collective community care that sustains and realizes mobilization. And then, of course, once we've put forward our policy demands and we've worked in solidarity in a collective, resisting the urge to be singled out, right? And to say, I am the champion of this, I am the champion of that. And instead sitting in deep humility and solidarity, right? And creating messaging that we facilitate and we accept can be captured and used by others not within our field, whether it be unions, right? Or political parties, that if the message is being put out there and there is this move towards our progressive objectives, then I'm not always against capture in that way. I think that there's a sustainability trajectory that is enabled through that process. The only thing I'm against is corporate capture.
Thank you so much, Masana, and thank you so much to everyone that has really taken the time to ask the questions and to the panelists. I will start by asking a question that was posed on Zoom, and it's posed to all the panelists. I think Tsogo can start, and then Lauren, and then Masana. So the question goes, what policy interventions are necessary to prevent the further marginalization of women in the economy? And the person that asked the question was asking that they get a different perspective, I guess, on this question based on, I guess, the work that you do and your expertise. And they really wanted was addressing the question to everyone. So the question again goes, what policy interventions are necessary to prevent the further marginalization of women in the economy? I don't know if Tsogo, you'd be keen to start first, and then Lauren, and then Masana.
Great, thank you for that question. I would say that we need to look at, so I think South Africa right now is going through a process of redistribution of resources, well, discussions on that. I think that it's important that women need to be centered, especially as a group that has not had access to key resources historically in different aspects in their relations of accumulation and interactions with resources. So yeah, I would say that we need to, in our policies, have women there who I know the speaker before me, Masana, just spoke to that, having like someone who captures, the conversation, but not necessarily that having groups of women who are consulted, having women engaging in decision making. I think that would be a good step towards changing the trajectory of development and women in South Africa. And yeah, that continued organizing. So just an institutionalization of it. Yeah, and I think that in terms of education, I think that women and young girls need to be prioritized and supported in a more meaningful way. And I'm not sure how that would look, but just a more concerted look into gender and making sure that we are producing more women through to the system. And at the university level, which I've spoken as like a place where the elites or the people who have increased capacity to change their own economic trajectory, there also needs to be a concerted effort to make sure that women are being supported through. So in the aspect of my presentation, that's what I'd say. I'd say institutionalized support for women at different stages and in different capacities, in different industries and spaces. So yeah.
Thank you so much, Tsogo. Lauren?
Thanks, Ntabeling. So I don't disagree with anything that Tsogo said, and I think definitely institutionalized support for women workers is crucial. I do think also that there's another layer or question, right, which is that we know that globally the trend is towards increasing precarity amongst workers, that many workers are kind of working with their wage cannot cover their living costs. So, this kind of emergence of the working poor. And so I think there is a question around not only how do you improve the position of women in the economy, but how do you take certain things out of the economy? So how do you disconnect certain essential goods and services from the kind of capitalist market relations? So, how do you decommodify education, healthcare, water, electricity, transport, leisure activities, food? How do you make those things that you don't necessarily need a huge wage to access? And given the cost of living in South Africa, the high rates of inflation on consumer goods, that wages don't cover these things. And so I think there's a parallel conversation to be had about decommodifying these goods and services and socializing the provision of them. Thanks.
Thank you so much, Lauren. Masana?
I mean, I don't have anything to add. I think Lauren and Tsogo have captured the responses perfectly. So I'm not going to add anything to their already comprehensive replies. Thank you so much.
Thank you so much, Masana. I'll then now move on to individual questions that were also posted on the Q&A chat box here on Zoom. So the first question goes to Tsogo. And the person asking the question is asking, How will jobs be affected if the introduction of compulsory vaccination will be applied in the labor market? I'll take that again. How will jobs be affected if the introduction of compulsory vaccination will be applied in the labor market? And that question is for Tshepo. I don't know if, okay.
No, go ahead, Ndeba.
No, I was asking if you just needed a bit of time, or are you okay to answer the question right now? Do you want me to read the other questions for the other panelists?
Yeah, could you read the questions actually? Yeah. Thanks.
So the second question is for Lauren. And the person asking the question is asking, how has COVID-19 affected, if at all, rural women and their access to healthcare and the rural economy? And what way forward do you propose? I'll take that again. How has COVID-19 affected, if at all, rural women and their access to healthcare and the rural economy? And what way forward do we propose? And the last individual question that I have so far is for Masana, and the person asking the question is asking, with a fourth wave predicted and a newly detected COVID-19 variant in South Africa, how do you foresee the impact on women's livelihoods in sex work, domestic workers, and informal traders? And how can undocumented immigrant women be integrated into the South African economy to ensure their human rights are protected, where they have become even more vulnerable during the pandemic? I'll take that again. With a fourth wave predicted and a newly detected COVID-19 variant in South Africa, how do you foresee the impact on women's livelihood in sex work, domestic workers, and informal traders? And how can undocumented immigrant women be integrated into the South African economy to ensure that their human rights are protected, where they've become even more vulnerable during the pandemic? So I'll start with Tsego's question, and then I will move on to Lauren, and then we'll do the last question with Masana. But in the meantime, if people have other questions, please just write your questions on the Q&A section of the chat box on Zoom. Thank you. Tsego, over to you.
Thanks for that question, Nompumelelo. I think maybe if you asked it to me directly, like if you were speaking, it would be more clear, because I'm not sure of like the underlying assumptions that you're asking the question with, and like the direction. But my understanding of the South African labor market is that it is very precarious, and that it is more, there's more supply than demand of workers. So my intuition is that if they put you have to get vaccinated, then it would just be that most people would get vaccinated so that they don't fall out of the labor market because of our high unemployment. So my thinking is that it would have limited effects because there's just the supply is much higher than the demand of jobs. So yeah, that's why I wanted to really know what would have been your approach to it. Would you be assuming that people don't want to take vaccines and that they feel like there might be an infringement of their health, or if there's any conspiracies, or would it be from the attitudes of people wanting to take vaccines? In that case, I think it would be positive nonetheless. But yeah, I think just because of the way that the labor market is, where there's far less jobs, more people will do whatever it takes to maintain their work. So I hope that answered your question. Just from how I engage with the question, that's how to answer.
Thank you, Tsego. I think if Nompumelelo is still on the call, she can maybe ask the question and maybe contextualize it with how she was asking it. I don't know if Nompumelelo, you are ready to further give insight or like a framework to the question that you asked, Sikho. Maybe while we wait for Nompumelelo to prepare herself, would it be okay if I move on to Lauren? Okay.
Sorry, can I just, yeah. It's Nompumelelo here. I just wanted to find out because once again, we're going to be faced with the issue of how capitalism will over trump what people consider the human rights, which is having a choice to not vaccinate, right? Because initially the state said it's not compulsory. So then when now capitalism then overrides people's choices of not wanting to vaccinate, then how do we draw the line as people then also engage with the issue of labor markets and jobs, right? Because even though there's a high number of people that need jobs, but now when we look at the dynamics of the private sector, how will the private sector be regulated in order for them not to impose their demands on workers and somewhat forcing them to vaccinate? So those are the kind of things, whether or not capitalism will then trump people's human rights. And by the way, I'm vaccinated, so don't think I'm shady or anything. So that's that's all I wanted to say. Thank you.
Okay, awesome. Yeah, I in that case, I don't think I'll change my answer. I think that it would be the same. And as you've said, capitalism, in the case of the South African economy, like I'm not sure, I think it was Masana who said how the finance sector has so much power and authority in South Africa that they are affecting policy and how the trajectory of like key issues that benefit them. So I don't know, unless they could be lobbied, I would not see them being opposed, in my opinion, especially in the job market that we are in. So yeah, thank you for the clarity. But yeah, I think I'd keep the answer the same.
Thank you so much, Sikho, and thank you so much, Nompumelelo, for clarifying your question. I don't know if Lauren is ready with the question that was posed to her.
So I'll give a short answer because I know time is also short. I mean, I think rural women, like women in cities, there's been a similar impact. So if we think about our rural areas, most women are working in the informal sector, working as subsistence or small scale farmers, doing domestic work, in areas where tourism is a big part of the rural economy. All of those jobs were destabilized, lost. So women, in terms of their economic position, have been left in a much, much worse off position during the pandemic. I think the lockdowns in particular had a heavy impact on women. In terms of moving forward, also in terms of access to healthcare services, the lockdown and also existing limitations in terms of access to clinics and so forth, that has been made worse by COVID. So during the first and second waves, and now again during the third waves, there's been a big demand for hospital beds. And that's meant that non-COVID services have been neglected. And so in that sense, rural women, again, have been negatively impacted. In terms of access to vaccinations, rural rollout has been delayed. That's connected to the delay in accessing Johnson & Johnson vaccinations, which we now know, even though South Africa is doing a fill and finish locally, the bulk of the first batch was exported to the EU. And because Johnson & Johnson is a once-off vaccination, it was hoped that that would be the main vaccination in the rural areas. And so that's not been the case. It's been delayed. And so lack of access to vaccinations in rural areas remains a problem. In terms of vaccinations, I think what we need is mobile vaccination sites, people going door to door. and making the service and also the information available in people's communities where they live. I think given the distances people have to travel to access healthcare services, it's going to be difficult for people to go to a centralized vaccination site. Excuse me. And then in terms of, kind of emergency assistance during in terms of the economic impact, definitely a basic income grant is a starting point, and probably we need to think much more broadly than that. And one of the things I think that comes into play here is access to land and giving women ownership and access to and control over land that they can then use as they deem fit, whether that's for subsistence or also subsistence and small scale farming to sell a proportion of what they cultivate.
Thank you so much, Lauren, for that response. Yeah, we have one last question that was directed to Masana. And then we also have another question that was asked, I guess, for all panelists. And I guess after Masana answers, I'll ask the question, and then we could also incorporate this question as part of our closing remarks. And then I'll hand over to Gia. But for now, I'll hand over to Masana to answer the question that was posed directly at her.
Thank you so much, Deborah. So I think, what we know with the fourth wave on its way and this new variant being detected and being discussed in the news today is we will continue to see, I think, just the enforcement of precariousness on South Africans, especially Black women, and then of course on non-South Africans in South Africa who are Africans or people of color, predominantly African women. One of the things that we've been mindful of, and it has been described as sort of the second pandemic, is of course that gender-based violence, instances of rape, I think even looking at the police statistics in a 3-month period, over 10,000 cases, that we continue to see sort of this enforcement of like sexual violence in our country. And this is only for people who are reporting. And I remember there was a comment made at the Code Red protest that if, gender-based violence and femicide were really the second pandemic, then we would see the resources being applied towards addressing it and its root causes at the same level and intensity as we see with the actual pandemic. And I think the thing is that it's not really a pandemic, it's an endemic level of violence and toxic masculinities that enact their militarized masculinities on the sites of women's bodies. And until we're able to shift public discourse, I think quite critically around the necessities of the NSP on GBVF, and also the role of women within our society, women and children in particular, then we will continue to engage with these or find these cases of high levels of sexual violence. And then, of course, economic precarity, right? And that economic precarity being around the capacity and options for people to even escape toxic relationships. I think, this question around undocumented women, and even I think it relates to the question of sex workers, for example, and integration or formalization in the economy. What we don't necessarily want is the continuation of commodification. So we don't necessarily want people to participate in the economy for the sake of economic growth or the expansion of sort of this capitalist agenda for workers in particular. I think really for me, and I say this from my own perspective, the real question is what is the quality and the dignity and the decency of the work that is currently being provided that we would want undocumented women to step into. So it's not that undocumented women are not working, right? Some has this wonderful paper on social reproduction, where she reflects, for example, on encouraging the participation of women in the economy, in and of itself, not mindful of the consequences this has on their capacity for rest in their unpaid care work. And so, what we really should be calling for in an intersectional and critical feminist theory perspective is like meaningful participation, dignified participation. And then, of course, systems thinking around the broader political economy and how it dehumanizes and demoralizes people across the world, and in particular, those who are mostly marginalized. And decrim of sex work for me is a dignity issue, right? It's the decriminalization for the realization of choice and options of sex workers, the access to social services and benefits. And it's part of a larger strategy, but it's not to say that it would be integration in and of itself without looking at transformation of the entire political economy as it stands. Thank you.
Thank you so much, Masana. I think before I ask the closing question, which I think would then be tied on with our closing remarks, I will ask Maxine to maybe ask her question. I don't know if Maxine is still on the call. Just to like clarify the question a bit, I think Maxine was asking all the panelists. So if Maxine is still on the call, I'll just ask her to ask the question and clarify a bit, and then I'll then ask the last question. But maybe just while I wait for Maxine, the last question that was asked is that what other means of organizing do we have outside of physically gathering, obviously with the pandemic and restrictions? And I think we can then answer this question from our respective work and activist work that we do. I think the idea of social organizing is that we do activism in different ways, be it in academia, be it protesting, be it in just multiple ways. So what other forms of organizing do we have in a time where our ways of organizing that we've known and historically relied on have been quite disrupted? So maybe let's think about that and also link this question to our closing remarks before I hand over to Gia. But in the meantime, I will ask Maxine if she is still on the platform. Okay, Maxine, you can ask your question.
Thank you, Ntebaleng. Just to clarify, so my question is, how do you, this is for any of the speakers, but how do you see the personal transformative work sort of that one would do on an individual or a collective basis happening in society at large, particularly during the pandemic, and has this kind of work been impacted or affected by the pandemic at all? Because I think a lot of the crises that we face in the world, whether this is political, economic, ecological, they all, it all boils down to people, and people are the ones that need to draw up policy. People are the ones that need to implement policy. So when that particular person holds a particular worldview that may be problematic in terms of gender identity, sexuality, class, and race, how do we see that level of thinking being addressed? Because I don't think that there's it's all good and well to have policies, but if it reminds me of the situation where legally same-sex couples can get married, but the officiator at one point could refuse to marry people. So I'm asking it sort of from that perspective. I hope that makes sense. Thank you, Ntebaleng.
Thank you so much, Maxine. I don't know if any of the panelists want to start in terms of answering Maxine's question. Masana?
Thank you. I'll try and be brief. And it is to say that I'm not personally very good at sort of reflecting on people who are on the other side of the spectrum. I know that there is a stream of work that looks at the far right and how to shift perspectives on the far right. And what the research has indicated is actually, what we need to focus our energies on is sort of youth mobilization and conscientization, right? So of young people, of not just I think a lot of times the interventions now are around like job creation, or you can start a small to medium enterprise, right? And you can get a job if you do X, Y, Z, and really the work of conscientization. So what does it mean to be human and in the world and to be caring and to do love work, for me is the critical shift in sort of discursive feminism that is needed, and popular education, which is around some of these feminist principles. And then secondly, of course, they say that don't focus on the far right, focus on the people in the middle, right? And I think part of that language and popular education is around sort of making the case. And I'm terrible at that. I know I have this tendency of believing that there's so much amongst Black feminists, right? There's so much difference and divergence, and there is this need for cohering ourselves and holding ourselves that becomes critical in the face of our struggle and our resistance. And you see that with the total shutdown protest, with the Code Red feminist protest, is really that once we cohere ourselves and we make that case for ourselves and we elevate the humanity and the dignity in our ways of working in our communities of care, then we are better able to tap into solidarity networks that represent broader spectrums and alliances, such as with unions. So for me, that becomes important. I need those safe spaces as an activist. I need those silos to sustain my mental health, because all of it out there is a lot of attack against Black feminists. But I'm encouraged to work with people who want to do the work of changing other people's minds, right? And doing that popular education with people who are anti-feminist.
Thank you so much, Masana, for that reflection. Lauren?
Thanks. Not easy questions. So I would say one thing is to keep doing what the organizations represented here, so Atlantic Fellows, Rosa Luxemburg, AIDC, to do what they do, which is put out alternative information, right? So to show why it's actually possible not to implement austerity budgeting, Not only that there needs to be a political push, but these are the figures, these are the policies, this is how you move to climate jobs, etc., etc. So to shift the limits about thinking about what's possible through alternative information. That said, I think at the level of adults, we're quite stuck in our thinking. So even if I take myself, I don't know how I'm going to go from believing what I've said today to believing the opposite, right? I can only imagine the same is true for an adult on the other end of the political spectrum. So what then? So I think one thing in the midst of the crisis, a concrete act of solidarity that we can take, regardless of our political position, is to get vaccinated, right? So whatever you believe, you are a member of society. We have an obligation to protect each other. One concrete, straightforward, simple way to do that in the context of this crisis is to get vaccinated. It's not going to resolve everything, but it might shift the baseline. And then I think, so maybe in terms of transformative work, yes, we need to focus on adults, but I think we also need to pay attention to what's happening with children. I think children have been really negatively impacted by the pandemic. There's a big conversation going on about children and food or lack of access to food. There's a big conversation about violence in the household. There's a big conversation around children in schooling years lost. But I think we also need to have a conversation around loss of parents, grandparents, uncles and aunts, children and death. And you know, how do we start really building a society that kind of assumes that children are there, that they are a reality, that we look after them collectively? Because at the moment, I think most of the time, they're treated as an inconvenience. And if we can start thinking about collective care for children and how do you shape children's consciousness so that you know, their thinking is to build a different kind of society, actually, where people can live together, can live well, there's justice, fairness, all of these good things that we want to secure, then maybe that's where we need to focus on. Also, not only, but also. Thanks.
Thank you so much, Lauren, for that reflection. I'll ask Tseho to give her perspective, and then I'll then ask for your closing remarks.
Cool. So yeah, I would definitely say COVID-19 is a transformative moment for everyone. And I know it's a cliche to hear by now that it affected everyone. But I think in South Africa, that's very important because of our inequality, that people can experience a crisis while other people don't even know about it, you know? So I think that COVID-19 has really forced a reckoning for everyone, since everyone's lives were affected and also anyone could get COVID. So I think that there are a lot of people who are thinking about how to move forward in a more sustainable way so that we don't find ourselves in a situation like this again, where everything, like the economy is, you know, collapsing around everyone and everyone's livelihoods are affected. So for that part of the question, I agree with you that it is a very transformative moment. But another aspect, I want to support what the other two speakers have said already, speaking to popular education and also the youth and young people who have lived through the pandemic and are dealing with what it means. I'm part of an organization that is called Rethinking Economics, and we work at a university level to speak through and analyze whether the economic syllabus is speaking to the realities that we see in society and what is happening around us. So I think that challenging the syllabuses and like the pedagogy at different levels of education for our youth is something that is very important, and that's how we can get people thinking in a way that is towards humanity and you know, in a changed way, or to challenge their thinking that that the world has, like, you know, like the capitalist system has imparted onto them. So yeah, popular education and speaking to the youth and yeah, getting them to see the world in a more humane way. Thanks, great question.
Thank you so much, Tseho. Yeah, I think just with your closing remarks, and we can link this then to the question I asked earlier, that someone posted on the Q&A section, to say that what other forms of organizing do we have outside of physically gathering? And I think we can really just do that in reflecting on our own different positionality as activists, but also as people that do different work, right? Very similar work, but also very, very different work. So maybe I'll start with Tseho. Or let me, I don't know. So can you take can you give us your closing remarks now? And then linking them to this question. And then I'll take Lauren, and then I'll take Masana, and then we'll hand over to Gaya.
Cool. Yeah, thanks so much everyone for the time and to share some of my own thinking and some of the work that we've been doing, and to connect with some other people who are thinking about the same thing. As Nteba said, we are all doing, and we're trying to move in the same direction, but doing different work. So it's really good to connect and to see that people are on the same page. Yeah, in closing, I'd like to say that gender is very important. And as a person who's working on getting a gendered aspect into universities and the economic syllabus. So the next generation of economists and policymakers are thinking along the lines of gender and the nuances of how resources are allocated in the country. It's a very important conversation to be having, and I'm glad a lot of people are having it. Just to answer the question, I think that digitization, I know it's becoming a cliche to say, but I think digitization is very important. It's democratizing conversation, and people who would have in the past not been listened to can get onto their cell phone, can get onto Twitter and Facebook and say something, and there's opportunity for it to be amplified. And even in my own work in economics, finding different economists, I can see Charlotte's reply about mobilizing at a global level. I think that digitization has made that possible to speak to other people in different economic contexts and who are working on the same issues, on some of the issues, and connecting them together. So yeah, I think that that's how we move forward. And you know, the internet and the digital space is here to stay, and governments and people in power are very threatened by it. So I think that it's a very, very important space that we can utilize and should be utilizing. And thanks again.
Thank you so much, Tseho, for taking your time and being with us today. I will then hand over to Lauren to answer the question and also give us the closing remarks.
Thanks, Ntiveling. I was hoping actually that you would let the question slide about alternative ways of organizing, because you know, I've thought about it, and it is a question that stumps me. I think, you know, Zoom meetings, WhatsApp, you know, groups and so forth. These are the things we've fallen back on, but it's actually, it's quite difficult and it's quite strange to exist in this virtual space. I think also, you know, given that data costs and electricity costs are so high, it's not a democratic space. It's not an easy space to access. And then that's not even speaking about cell phone towers and infrastructure in rural areas or in certain neighborhoods in cities. So on alternative models of organizing, I don't know. I think probably we need to think of alternative ways of just being together in the context of what seems to be a COVID pandemic that's going to last a long time. So to think about what it means to be physically together again, and how do you do that safely. And then, you know, I mean, in terms of closing remarks, just to say thank you for arranging this exchange. I think it's an important topic, and unfortunately, I think in terms of the uneven impact, the gendered impact of COVID-19, it's not going to be a topic that goes away, because many of these negative effects are structural. And so we're likely to see at least one generation of women being negatively impacted in terms of their socioeconomic, educational status and the rest, and probably more than one generation. And so that's the reality that we're dealing with, unless we do something to change it. Thanks.
Thank you so much, Lauren, and thank you for taking the time for being with us today. And then I'll hand over now to Masana to give us the closing remarks, as well as answer the question on alternative ways of organizing during this time that we find ourselves in.
Yeah, thank you so much for the question, Ntiveling. And I think what I will say, reflecting on the Black Lives Matter protests that spur up across the world, a few months or a few weeks into the pandemic, what I've noticed, you know, is that for many people across the world, whether or not to mobilize is not an option. It's almost it's a question of luxury. And in my activism, recognizing my middle class privilege, one of the things that I have said, and I have put out the challenges, you know, oftentimes we do need to equalize the stakes. Like we know, like the research shows, there is evidence that mobilization in and of itself is one of the most effective ways to shift policy. right? It's one of the most effective ways to undo, right, capitalism. You know, that if capitalism is individualistic and pushes for an individualistic agenda, then mobilization in and of itself is an innate response to that. And then when I think of sort of the COVID-19 reality, and I think of, you know, the CANs, so the community action networks and the feeding schemes and people going out into communities in the wake of the looting, people showing up in solidarity. I hate to be a Puritan, but I think that there are very few alternatives. There are very few alternatives to in-person mobilization, but mobilization doesn't necessarily have to look like a protest. There does need to be sort of the showing up and this deep listening in the showing up that is necessary for not just the redistribution of resources, but for ensuring, you know, like when we protest and there are certain races on the front line, we know we're less likely to be arrested or canned. I mean, at the protest on Friday, the police appeared with these massive vans, right? But I think because of sort of that class privilege and that civil society privilege, it didn't escalate into violence. And so for me, I want to challenge that, is that perhaps the alternative isn't not showing up, especially as officials are using freedom of assembly restrictions to crack down on mass mobilization. It's actually for us to show up, but then to redistribute resources that allow that showing up to be safe for everyone, so that those who can show up must show up, you know, and that is my challenge. And I also want to say, you know, as I reflect on sort of this digital engagement, and I do think digital protests are so important and so powerful, but that the data divide, which is largely gendered and largely racialized, not just in South Africa, but across the continent, with some of the highest levels of gendered digital and access, that actually we are doing a disservice to people by thinking that we are ready to transition into this digital way of working. And my challenge is then, if we want to do this mobilization and this access work, you know, how are we thinking about innovation? How are we even thinking about technology and coding, and how even that coding in and of itself is racialized and exploitative, and artificial intelligence in and of itself is perpetuating access to information differences and inequalities across the world. And so we do have a lot of deep work. We need a lot of sitting and thinking and reading and learning and cross-pollinating work to make this vision a reality. And as an Atlantic Fellow myself for social and economic equity, you know, I think that's one of the powers and the beauties of being able to be part of a global solidarity network, is that we can be aware of these issues when we think of alternatives and put forward again, you know, sort of this radical approach. Let's not shy away from the gains of the feminists of the past in our collective action and our demand for change. Thank you so much. And thank you for having me in this space. It's been an honor and a privilege.
Thank you so much, Masana. I will hand over to Kia right now to give us our closing remarks. But before I do that, I also want to say thank you to the panelists. I think your work today and the insights that you've shared have really challenged us and allowed us into a space of deeper thinking. Thank you for sharing your work and your insight with us. I will hand over to Gia right now to do the official closing of the event. Thank you so much.
Thank you so much to all the speakers, everyone who has joined the webinar. I'm given the unfortunate task of closing such a powerful discussion, which makes me a little bit uncomfortable. But I wanted to say a few things actually that I heard a lot from the speakers, and I wanted to actually start off by really saying that we as people are part of social justice circles or even in CSO, we tend to lament the opportunities of sitting and being in conversation with each other. And I think we need to stop a little bit in terms of lamenting that, of course, calling out problematic spaces where political pontification takes place, or even intellectual pontification takes place. But I think spaces in which that are trying to expand and look at whether it's gender issues, but in particular from my personal perspective, feminist issues, they're critical today, they were critical yesterday, and they will continue to be critical. So I'm very excited and happy that we were able to have this conversation today, and hoping that we're going to have many other conversations linked to this going forward. I think there's several things that have been said by the speakers actually, which is around, I think, I could go on actually quite a bit, but one of the things that really spoke to me was the points that Lauren made around austerity. And actually, funny enough, a colleague of mine, Dick Forsland, this morning was in a Cape Talk interview speaking about the public sector wage bill. And it's been particularly interesting to hear how the current Minister of Finance has been tiptoeing around it. And I mean, you know, some of the things that Dick Forsland has said, which for me are actually important in terms of this conversation, which is the public sector in South Africa is not bloated. Austerity kills. People are dying due to the lack of staff in South Africa, where half of the population is already living in poverty. We need and we have to have a strong public service. People can't pay fees for private schools, so they can't pay for a private doctor. And this speaks to the points that Lauren made around the fact that 80% of the population is relying on a public healthcare system. I think some of the other things that were said, which are things that I think I want to underscore and talk a little bit about, is some things that Masana spoke about, which actually got me very excited. If I had had my camera on, I would have done this the whole time, which is the discussions or an analysis around, you know, the political economy of the world, and how understanding and critically engaging with the political economy of the world gives us an opportunity to slightly understand what is happening, and also maybe an opportunity to start thinking about how do we usher ourselves out of this mess and chaos. I wanted to say something in relation to the fact that sisters and comrades, we need to remember that capitalism flourishes on othering. So we spoke about how it makes individual struggles, but in essence, capitalism flourishes and is able to thrive, expand itself by othering people. So it's othering entities or othering other things in society, because it is the only way you can justify exploiting, expropriating, and inflicting violence on groups of people by thinking and considering that they less than. So women had to be considered less than, you know. Queer folks have to be considered less than. And we need to talk about these things of how queer politics, right, are an issue or a problem in the sense for the capitalist system, not only for the sake of what people are trying to kind of, you know, push and ask critical questions about sexuality and the gender binary, but in essence, the issue that capitalism and neoliberalism has around us questioning the gender performance, gender conformity, the binary, and even our sexuality, because they cannot sell products to people that don't identify either as male and female. So this will then strip and flip over the system itself over its head. And I think then another thing that we need to think about is, if we're saying and with an agreement that austerity kills, therefore then austerity and challenging austerity becomes a feminist issue. If we're saying that the unpaid care work of women has built this economy and has built many other economies in the global south and in the world, then austerity is a feminist issue that we're going to be needing to thinking of tackling. I think a challenge that I would like to give to everyone on the call is in ourselves is we now need to move a little bit beyond the conversations around gender and the binary and start talking about feminist politics and feminist lenses of thinking about things, because feminism is not necessarily intrinsically linked to either how you identify and how you are, but it's about dealing with the inequalities in society that have been perpetuated, exacerbated, and created by a capitalist mode of accumulation. And that exists everywhere in South Africa and around the world. I wrote several things down, so this is why I keep on kind of looking a little bit at it. The final thing that I'm wanting to say, kind of to wrap everything together from my point of view, and links back to what actually Charlotte said, in the chat around a binding treaty or something that governs and rules the actions of transnational corporations, and in essence then will regulate the actions of transnational capital. If we're speaking about giving people a basic income grant, and we're speaking about giving people or citizens or just people who are alive or human beings dignified wages, and we're scared about the fact that it's going to lead to capital flight or illicit financial flows, one of the means that we can coalesce around as sisters, as feminists and people in Southern Africa, in Africa and around the world, is demanding a UN binding treaty on business and human rights that is going to tackle the role of transnational corporations or capitalist elites in the world, because this is a global struggle. So those are just like the few things I was thinking of leaving folks with, and saying that I think one of the most important things that has come out in this conversation is we need to go back to community. We need to go back to the community of care. Sylvia Federici and other folks who worked a lot about debunking some of the challenges that women have faced in history, speaks about the fact that capitalism couldn't stand the fact that women in communities were taking care of each other, taking care of their families, and some of them were midwives. So they had to take away the idea of community and building community so that they can commodify things. Lastly, I keep on saying these are my last points, but I'm given the opportunity to close. I wanted to say that we also need to think about the fact that basic services cannot be commodified. And 95% of the issues that we're facing, whether they're socioeconomic or just political issues, are the fact that we have wanted to let the public sector, the private sector actually, or the capitalist sector, to take up basic services. You cannot want to make a profit from giving each and every single person electricity. You cannot want to make a profit on making sure that everyone has roads, water, proper healthcare, and a dignified life. And the fact that these things have been made commodities so profit can be made out of it is where we find ourselves today. Lastly, I believe that in order for us to think and to work towards dealing with the digital divide, is demanding and putting forth that the right to information needs to be a basic and global human right. If we then believe that the right to information is a basic and global human right, we will then make sure that the tools, the things that need to exist to make sure people have access to information or the internet then are created and open the paths for that to happen. One last thing from my side, again, sorry, comrades, is one of the ways that I think, and I just wanted to share, that we can challenge or make sure that actually policies are designed in a particular way is when we start thinking of who do we think is going to transform society. If we change who we think the change agent is, then we'll be then working towards developing policies that are going to contribute and improve to the lives of each and every single person walking on this earth. Thank you so much. And again, thank you for joining. Thank you for signing up and registering. Hopefully this is just one of the first sessions that we're going to be having as a collaboration between Rosa Luxemburg and the AIDC. I'm going to hand over then to Siko, who maybe might want to say some final things from Rosa Luxemburg's side. But I wanted to say to everyone who's still on the call on the Zoom, thank you so much for joining. And I'm hoping that next time we might have a lot more people in the room with us so that we can engage meaningfully and in a robust manner. Thanks for all the panelists and everyone's patience. I'm going to hand over then to Siko.
Thank you, Kia. I think you've summed that up very well. I'd just like to thank the panelists again once more, and to thank the facilitator Ntebeling, and to thank you, Kia, and AIDC for the collaboration. Thank you and good evening or afternoon.
Bye. Bye, everyone.
Bye. Thanks, everyone. Bye.
Thanks, everyone. Goodbye.